Yeah, we get into this field to help people, and we're here to help you see what clients are showing you so that you're not another person missing their story.
Right? And for those clients missing their story, regardless if they're 4 or 14 or
Mhm.
44 or 74, that doesn't matter. When you miss their story, you're another person who's not seeing them, hearing them. And that is not a vehicle for healing. That is not something that is going to be helpful for them. It's going to continue to push all of the shame primarily and other
Yeah.
associated features down with it, and that's not what we want to do, and that's not who we are, and we can help you with that.
And for anyone who's treating adults and they think about this from this component of like listening to play therapists, listening to child-centered therapists, what I really want those therapists who are seeing the adults to really hold on to and notice is when you're learning about trauma, and you think that you come forward as, yeah, I'm a trauma therapist, I've taken this modality or that modality, and now I'm a trauma therapist. That doesn't land for all these adults that have experienced child sexual abuse as children, because you're not going to show up for them in the way that other traumas will present. It's like a very different presentation. There are so many ways that this shows up. And until you have that full picture, you're not going to be the best you could be. And really, that's what we all want to be, right? We want to be the best therapist we could be for our clients. And sitting with a survivor of sexual abuse, if you don't have that full piece, you're not going to be able to be fully showing up the way you should be.
Imagine feeling like you're enough and you have what it takes with even the hardest of clients, those ones that no matter what you do, it seems like they're not getting better and they've tried everything.
So I am so excited about what we are doing and what we are offering. And the reason I feel so excited about it is because every training that we see, right? If you're somebody who treats children, you take trainings for the most part that are geared towards children, right? If you're an adult therapist like myself, you end up taking courses, right, that are geared only towards adults. And if you are treating trauma, for the most part, specifically sexual abuse, if you sometimes you get to take a course that's talks about that specifically, but for the most part, it's kind of like peppered in, like into all the trainings that we've taken. And this
Mhm.
is like the reason this is so unique, and this is like to me the first time anything like this has been offered, is we are getting a chance to take people through from that child space, like through the adult space, and everything around sexual abuse specifically, which we've learned over the years is so different in terms of the treatment versus other kinds of trauma, which nobody really talks about. And I'm like so excited about that, what we're being able to bring and offer to other people.
Yes.
I also have to say, I think one of the things that I noticed, and I think that we have a shared experience of this too, not just as clinicians, not just as supervisors, but also as people who provide training and education, is that people have these gaps that they're trying to fill in, and all the different ways that they do that. But then they don't have something that is systematic. They don't have something that has been curated. And I feel like that's what we've really done is we've taken all these different elements of working with people, regardless of how old they are, with CSA, um, who we can highlight what the best parts of the work are and the most important parts of the work are. So you get 75 years, give or take, of combined experience here too. And so that comes from all different aspects of the work, but all of us specialize in working with sexually traumatized people. And so that is unique in and of itself.
Imagine having all those questions that are constantly coming up for you actually answered in one space.
Imagine being a supervisor, trainer, or educator and knowing how to answer those questions when they come your way in all one space.
Yeah. One of the things that we hear is, well, I don't treat clients with sexual abuse. And what we know is that the average age of disclosure is in the early 50s. So you have these clients on your caseload, whether you're working with kids or teenagers or adults. And one of the things we're going to help you do is recognize when you have them and know what to do so that you can help them.
Yeah, right. Imagine being able to treat your clients without knowing the details of their story. Imagine letting go of the pressure to know what happened to this person in order to be able to treat them. Imagine knowing that you can be the best therapist for this individual sitting in front of you without the need to have them be re-traumatized by telling you their story.
Imagine not being afraid of clients who have had child sexual trauma.
Perfect. I also think as somebody who treats most like adults, right? For the most part, my colleagues, I sit in trainings, all the time that are specifically geared for trauma, right? All these different modalities with all these therapists that are treating adults and sexual abuse, because it's a childhood specific situation. You miss so many components around through that child's lens when you're only learning it from the adult perspective, that you can't fully show up for these clients. You can't fully be there in the way that you should be able to be there with that other piece, all those missing experiences, all those missing components, all those pieces that you can add with that person that's sitting in front of you. Imagine feeling competent with all the clients sitting in front of you, no matter what's coming your way.